I'm Nairobi Stella, an enrolled midwife working in Katila Center here in Kabong district. I was sponsored by UNFPA, and what motivated me to be a midwife was when I used to see very many mothers dying due to home deliveries.
Most of the institutions in the country right now offer midwifery training. We have over 107 nurse and midwifery schools, and the majority of them offer midwifery at certificate level.
Right now we have midwifery services up to the level of health center 2. And health center 2 is when they have to do antenatal services. But you find that in health center 2, we have very few midwives. Yes. Then because we have few, there is also workload. You find one midwife attending to a number of mothers, or even manning more than 2 adjacent clinics. They also work for longer hours.
There is no activity or operation that have no challenges. And so even in midwifery training, there are challenges. The human resource, they trained midwifery tutors, they trained preceptors in the hospital who are willing to train may not be enough. We still have fewer trained people to train the others.
There is a lot the ministry is doing. First of all, recruitment is going on. But like you know, there is also a lack of resources that they cannot fill these health centers at the same time. But the Ministry of Health is doing recruitments every year when the funds are available. Ministry of Health has also come up with the training programs for the nurses to improve their knowledge in the advanced technology, also to improve their knowledge on critical care. Ministry of Health also sponsors some of these trainings for the midwives.
The challenges are being addressed through collaboration, like the Ministry of Education works hand in hand with the hospitals and the Ministry of Health to negotiate and advocate for resources. Ministry of Education of recent has just recruited the tutors to add on the number of tutors serving the schools, and do the same advocating for recruitment of staff on the side of the Ministry of Health. For example, for training, we have been collaborating with UNFPA to support the training of midwifery tutors, to support the development of a curriculum that is competency-based, and also to support the training of preceptors. So through UNFPA, we have trained over 100 preceptors in care, and in the last release by Uganda Nurses and Midwifery Examination Board, a report was given that students' performance improved greatly and was attributed to the training of the preceptors in clinical teaching.
We are proud to regulate the midwife because the midwife actually is a little doctor. Many of the midwives you find at the bedside in the health units down there in the grassroots, these people were lowly trained, the lowest training of cadre, that is the enrolled midwives. But when we go there, we encourage them to go for further studies, and many of them have gone to do their diploma in midwifery. Many of them have gone to do bachelors in nursing, because in nursing there is a component of midwifery there. But one most important thing is that masters of midwifery came in, and already we have nurses who completed their masters in midwifery. It's only Makerere University who is yet giving masters in midwifery. So we are very proud of that. We know that the midwifery is going to climb heights.
The bonding scheme for midwives was introduced in Uganda in 2010 to respond to a very high maternal mortality rate. We thought that we would not only train midwives but to bond them. That means that we are in a way signing a contract with them that they are obliged to spend at least 2 years after they've graduated in their districts in a given health facility to carry out their work. When we have funding, we inform a district that we have funding for X number of midwives. They then make an advertisement for the placements, and this is for placements in schools so that the schools can take in midwives to be trained. Once these girls have been selected and that the green light is given for them to go into the school, that's when they sign an agreement, a bonding scheme, whereby they commit that after they've graduated they are going to be working for at least 2 years in a health facility in the district. That's very important, in the district that they've been trained. So since 2010 we've had 590 midwives trained. So there's two aspects to it. It has first of all made sure that the midwife is getting the best possible accredited and regulated training, and that training is of course applied within a clinical setting for 2 years. After that, so it's both the training and the employment scheme, and that is where the bonding comes in. After that, the midwife is then able to apply her skills in the district and within the health facility of that district. So it's a tremendous effort of capacity building, and that capacity building is broken down to training and employment.
In average, we deliver like 40 mothers in a month at Cathedral Center 3. And what makes me happy, what gives me joy in my practice is seeing a mother going home with a live baby. And since we were recruited, home deliveries have reduced, maternal death has reduced because mothers now come and deliver from the facility. Early neonatal death has also reduced because mothers now seek services in the facilities because they are midwives.
We have had professional midwives in Sweden for almost 300 years. And we understand and we have learned that the role of midwives is so very important. I think also in Sweden we have taken a comprehensive approach. The midwife is actually responsible for everything relating to women's health. They work in a team closely together with nurses, with doctors, and I think that system, so to say, makes it efficient.
The one achievement that we can celebrate for midwifery services is the ability of midwives to contribute to the reduction of maternal mortality in Uganda. As you are aware, maternal mortality has reduced from 438 to 336, and this can be attributed to skilled attendance at birth, which has also gone up from 58 to 74%. And we know that midwives are the largest workforce when it comes to service delivery in terms of maternal health. So I really think we should celebrate that achievement, that midwives are there to address the issues for maternal health. that midwives are present at the facilities. Midwives are knowledgeable and skilled and able to address or handle the mothers the way they come in.
Children these days don't die because of a midwife as it used to be. Immunization coverage, midwives are the ones immunizing those children from the time of birth up to when they are grown up. So it is still a midwife who does that. So those two are key to the government and are key to the country. And if we did not have midwives, we would have deliveries by birth attendants, which would lead our people in problems.
The one game changer in the next 10 years, I believe, is holistic investment in midwifery, in terms of improving the midwifery workforce, strengthening the midwifery workforce holistically. We need an empowered midwife in terms of education that can meet global standards. We need an empowered midwifery workforce in terms of skills, but also an empowered workforce in terms of an enabling environment. We need to empower midwives further as far as evidence-based care is concerned, to ensure that we are able to provide respectful maternity care, whereby the rights of the midwives and the rights of the patients or our mothers are recognized and taken care of.
In the next 10 years, I feel that the changes can be in 3 ways. One, we need to build capacity of midwives by taking them to school, have them train well, get skills, and they will perform better. 2, we need to reduce the certificates. We want to train a diploma level and a degree and master level. Then number 3 is also welfare of a midwife, because every now and then she is on call. She's monitoring the mother, so she needs the pocket to be well.
If we increase the skills, if we update the skills, it will go a long way to reduce the maternal mortality rate and infant mortality rate and improve quality of the mothers, quality of the children or the babies that are born. Of course, as a result, the economy will improve, because healthy mothers make a family, and they make a community, and eventually they make the whole world.
We've seen a very sharp increase in the percentage of skilled birth attendants from 30 at the beginning of the scheme in 2010, so 30%, to over 70% in 2016, and that's the data from the Uganda Demographic Health Survey. The plans are that we are taking the lessons really from this very positive scheme to the larger health personnel workforce, task forces that are in the country, so that others can really inspire themselves for midwifery training and employment.
I would like to thank UNFPA so much for giving us this chance to train as midwives, for supporting us by paying our tuition. And we are requesting that you give us another opportunity to go and acquire more skills, so that we come back and serve the community when we are having more skills, and we can now save life better. And my advice to midwives outside there is to be self-motivated and to make sure that no mother or baby dies during birth.
We shall continue as much as we have funding available, but I do believe that the Ministry of Health has gotten to a good and comfortable cruising altitude, whereby they can carry out that same scheme on their own. In my many years of work with UNFPA over several continents and in many countries, I have unequivocally admired and respected midwives more than anyone that I come across in my line of work. So I want to thank them, and I want to really appreciate the work that they are doing. I know it's often very hard work and long hours, but you are the ones that deliver safely and correctly. So thank you very much.